computer. Perfect.
Okay.
All right, you ready to go? And my step will
Yes.
edit all of this kind of stuff. All right. Hey, Grace, how are you doing today?
I'm doing great today.
That's awesome. Thank you so much for taking a little bit of time, especially this busy time of year. By the way, belated Happy Thanksgiving and early Merry Christmas and Happy New Year.
Thank you.
Um, you're welcome. I wanted to talk to you because your story is really very unique and really interesting and compelling in so many different ways. We first met about 3 years ago. Can you tell me a little bit about what was happening with you with regard to headache symptoms and so forth at that time?
Yeah, so 3 years ago, well, I guess a little before then,
Mhm.
I developed this unusual pain where it was just we thought was maybe a migraine. But then it was ended up being weeks later and it just never went away and it was an excruciating pain, stabbing, aching, burning, all the above. But basically left me out of school, out of sports, pretty much bedbound for a few months.
And you were a pretty active young gal at that time. And as I recall, you had tried like a bunch of different meds and a lot of different injections and so forth as well, right?
Yeah, so I did all sorts of different things, massage, physical therapy, dry needling.
Mhm.
Um, we did nerve blocks, a few other different things too.
Right. And nothing really worked consistently, right? So when we ultimately met, we determined that there were a number of nerves in the back of your head that were causing this. And at the end of the day, we ultimately did an operation. It's literally almost 3 years to the day, 3 years and a couple of
Yeah.
days ago. Um, Tell us if you can remember a little bit about what the kind of surgical experience was like.
So after surgery, well, it was Christmas break, so thankfully I was able to rest for quite a couple weeks.
Mhm.
Um, but after surgery, the incision pain, I didn't really have any of that. I iced my head a lot, and I don't remember the pain being very bad after surgery. It was more so maybe like a month after surgery when the numbing wore off.
Mhm. Mhm.
And then I just kind of was dealing with like the nerve pain and just the headaches and just everything kind of settling and healing.
Right.
But the initial few weeks of healing were not bad at all for me.
And so, kind of cutting to the chase, because it's been 3 years now. Uh, as you had stated earlier, you had 24/7 pain. It was rated, I think we were looking at your notes earlier, 5 to 9 out of 10, pretty much all the
Yeah.
time. Where are you now?
So now I am pretty much pain free most of the days. I still get an occasional migraine here and there, but I don't have that 24/7 constant pain. I feel like I kind of just live my normal life again. It's almost
That's
like it never happened in a way.
that's so
So
great. And you recently had a nice milestone that you achieved, right? Tell us
I
a little bit
did.
about that.
I graduated nursing school.
Mhm.
Before all this, I remember one of our biggest fears was, am I even going to be able to go to college? Because it
Yeah.
came up during my senior year of high school. But I had that whole semester to heal and went to college, and I graduated December 6th. So I made
Yeah,
it.
congratulations. That's awesome. And you're doing trauma nursing, you were saying med
I
surge, right? At that
surgical
huge
trauma.
hospital. So that's incredible. Congratulations. And one other interesting case that I think is worth mentioning about your situation and the history after surgery was you had a little bit of a recurrence of your symptoms for a little bit of time following about a COVID, right? Do you remember how long your symptoms lasted after that?
Yeah, so I got COVID, and back then, like a big thing was COVID was headaches. So I'm like, okay, this is just normal, whatever. But my COVID went away, and I was still it felt like my pain all over again. So it lasted, I'd say, maybe a month, month and a half, where I was having that kind of pain. And at that point, we didn't know what happened. It kind of felt like I was set back completely to 3 years ago before my surgery.
Yeah.
But um, I mean, after a while, it got better, and yeah.
Yeah, you're back to the new you. And I think that
Yeah.
that's a really interesting thing because it's something that we've seen with some frequency since 2020, and obviously something we didn't see before COVID was a thing before then. But as your case illustrates, it really is something that oftentimes does get a little bit better with a little bit of time. And every once in a while you have to reoperate and actually remove a chronically inflamed lymph node that is now continuously pressing on a nerve that wasn't doing that before COVID. And is a good example of why, for example, some people, because one of the most common symptoms, certainly with long COVID, is chronic headaches, and is a
Mhm.
perfect illustration of why that could be. So anyway, it's busy time of the year. You've got a lot of celebrating to do for a lot of reasons. So I just want to say again, thank you so much for taking a few minutes, chat with us, and wish you the best of luck. Obviously, we're always available if anything comes up in the future.
Yeah, thank you so much. I really appreciate it.
You got it. Cheers.
Cheers.